Hi, I'm Abby. I'm one of the nurses in the Preassessment Clinic. I'll be doing your preoperative assessment for the removal of the skin lesion you have on your left eyelid.
Okay.
How are you feeling about having the surgery?
Actually, I'm feeling very worried about having it done.
I'm sorry to hear that. Can you tell me more about why you're feeling anxious about the surgery? Some patients worry about this type of surgery and recovering afterwards. Other patients worry about being in pain or having an anesthetic. Are you concerned about any of these?
Yes. I'm concerned about having the surgery under local anesthetic, as the lesion is very close to my eye. I'm also not sure about how to look after the wound when I go home.
I can understand that you might be a bit apprehensive about having a local anesthetic, but I can reassure you that there are several benefits. The procedure is very quick and you'll have a short recovery time with a local anesthetic. The local anesthetic numbs the area so you won't feel any pain during the procedure, just a little pressure. You'll be able to go home on the same day as the procedure, and there's also less chance of getting an infection.
Oh, I see.
It's quite easy to look after the wound when you go home. The surgeon will use dissolvable stitches, so you won't need to have them removed. You'll just have to clean your eyelid with a sterile saline solution and apply some antibiotic ointment that will give you before you go home.
Well, that sounds okay. I feel much better about having the surgery now.
That's good. Can I ask you some questions about your general health now?
Sure.
Have you had any illnesses or infections recently?
No, I haven't had any illnesses or infections recently.
Have you had any changes to your regular medications?
No, I haven't.
Do you have any allergies?
No, I don't.
The last question is about how you plan to get home after your surgery. Have you made arrangements with a friend or family member to pick you up from hospital and take you home?
Yes. My daughter is going to take me home after the operation.
Great. You may feel a bit unsteady on your feet for a little while after the operation, and it's not safe to drive yourself home. Now that I've got all your details, I'll do your clinical observations. I'll take your temperature, pulse, respirations, and blood pressure as well as your oxygen saturation levels. Do you give me your consent to start the clinical observations now?
Everything's clear now, and I give consent for you to start the clinical observations.